Okay, the next technique that we're going to do is forehead rejuvenation. A lot of people, as a lot of people lose forehead volume, it's an area that's really been neglected for a long time. And I've kind of drawn out a line here. I'm going to be doing a backfilled ultra in an insulin syringe. When we say backfilled, meaning we take ultra 50-50 blend, we take this out, we inject the ultra into the syringe, then we put the sterilely, we put this back in, so this tip of the needle has never is not dull. It's going to be sharp, which means less pain for the patient. And our goal is to put filler all the way up here. Why? Because when we do that, the volumetric expansion just kind of lifts up this brow complex and opens people's eyes and makes them look more youthful. And also that forward projection of the forehead makes people look more youthful as well. So when you get started, it doesn't take a lot of volume to do this. I'm going to be doing a serial puncture technique where I use this to go through the frontalis muscle right on this into the supraperiosteal location and deposit small aliquots, usually 0.05 per injection of 50-50 blend of ultra. That's one. I'm just going to march over. Two. And just kind of a slow, steady pressure to inject filler. I'm kind of using this finger to just hold pressure because, again, I want to be in this very superior injection location. Every now and then when you get out laterally, the superficial temporal nerve is right here, a sensory nerve, and you can sometimes tickle it and people will feel the sensation that goes to the back of their head. But what I also try to do when I do this technique is, you can see I'm kind of going in this direction to get lidocaine ahead of the needle so that when I do the next injection it's less painful for people.
Mm-hmm.
You're doing great. Good. I'm all the way out here. This will be the last injection on this side. The nice thing about Ultra 50-50 blend is it's very compressible. So once I've done this, where you don't leave people lumpy bumpy, you can just kind of compress it and flatten it right out. Okay. So I've done this side of the forehead. I'm going to now work my way in the other direction. Same idea. Again, small, tiny micro aliquots just below the hairline. And if you're lucky, you don't hit any veins and there's minimal bruising, minimal bleeding. Doing okay, Linda?
Doing great, thank you.
Good. And when you look, you say, well, who cares about that area up there? You know, this is definitely a treatment that we do because we're looking for that secondary benefit. When I say secondary benefit, meaning to get filler here, to get the secondary improvement by lifting the whole brow complex. Okay, great, you did well. Okay.